And welcome back. Well, today we are going to talk about the diagnosis and treatment of vein disease. Doctors usually diagnose superficial problems based on medical history and a physical exam, but deep vein problems, which are much more serious, are often harder to detect.
So how do you know when you need to have more tests? Dr. Jeffrey Sabatino is with Mequon Vein. He is here to talk about the common symptoms of vein disease and the advancements in treatment of it too.
Yeah.
Great to see you.
Thanks for being
Molly.
here.
Thanks, Tiffany.
And we say Mequon Vein, but I think it's important that we mention you've got locations in Mequon and Germantown, newly going to be in Brookfield. And
Congrats.
that's one of the reasons
Thank
you're
you.
here. Yeah, that's exciting.
Thank you. We're very excited to be opening in Brookfield. We've been in Mequon for 7 years, Germantown for 6. Practice is growing rapidly, and now we've been able to open in Brookfield.
That's
wonderful.
really exciting.
Thank
Let's talk about vein disease because it's something I think people are getting more comfortable hearing about and understanding. But how do you often find it? What are the most common symptoms that people are feeling or saying when they come to see you?
Sure. And I'm so excited to be able to tell you about this because there's so many people that have this but don't actually realize it.
Yeah.
The common symptoms would include achiness and fatigue in the legs. The key here is that if you're developing these symptoms during your daily routine and your legs are tiring and sore before your upper body, that's not normal. And
So even if you're on your feet a lot, because people kind of have that, give themselves that excuse, that's still not right.
Exactly. My shoes, I've been on my feet.
Right.
This is what, but no. So when I'm done treating my patients, their symptoms are gone. And so over 15 years, a month after we're done, I have them come back and I ask them those original questions. Do you have that achiness? Do you have that fatigue? 9 out of 10 of my patients leave my practice completely symptom-free, and they never knew that these symptoms were caused by their veins. It feels just like muscle fatigue, but it's not.
That
Tricky.
is wonderful.
Yeah.
Yeah, very tricky. The other thing I wonder about is the diagnosis. Is that tricky? Because some people might wonder, well, I don't see any problems. I just feel those symptoms you mentioned.
Sure. A large majority of my patients will come in with leg symptoms, including the ache, including the heavy, including leg cramps. Charlie horses, foot cramps, toe cramps, and even restless leg syndrome. Go to their doctor, not really know. Honestly, this is not taught in medical school very well. Varicose veins is kind of forgotten, and so the teaching in this is more of a mentorship than a university-style residency. And so I'm family practice. I was not taught about these symptoms. So they come in with symptoms, maybe they did some reading and think maybe they have varicose veins. And so our diagnosis involves an ultrasound screening. That's the first visit, an ultrasound screening. We'll teach about, for roughly a half hour's worth of that time about, whether or not you have this and how these symptoms fit in and generally what we can be doing about it.
Yeah, because you can figure it out right away. I often hear people being like, oh, I just need to eat more bananas. I need more potassium. And it's like, no, there might be a much deeper reason you're having these problems. And so what kind of treatments are there? So you do the ultrasound, you figure out, hey, these aren't just cosmetic. There's some problems here. How do we treat it?
So there's multiple different treatments. At Mequon Vein, we strive for as few treatment failures as possible. And so quality care is one of our hallmarks. And so the laser that we use, we're catheterizing veins. It's all outpatient. It sounds complex, but it's really fairly simple. People don't miss work.
Pretty quick, right?
Yeah, I mean the treatments are an hour, but there will be multiple because if they come in with a need for a fair amount of work, I'm going to divide that up into little bite-sized chunks so that they can continue working, not need pain medicine. But the laser has a very, very low failure rate. National sort of statistics and numbers would give it a failure rate of 1% to 2% compared to the rest of the other surgical or other invasive technologies which have higher failure rates. And so my personal failure rate in my practice is more like 0.1 or 0.2%.
Wow.
We really strive for high quality.
In terms of recovery, people wonder, are there limitations? Is there a lot of downtime?
No, so I've had it done too because I have this, and I didn't miss a day of work. Most of my patients don't miss any work. Tylenol, ibuprofen are the typical medicines. This is all outpatient. It's fairly simple. The procedures we schedule between a half hour and an hour, so no, it's not a lot of time out of your day. And the restrictions would be few. Intense exercise, heavy lifting, that's gonna compromise results. And then I need you to wear stockings, which help to keep the veins compressed.
But they look good these days.
Yeah, there's some cute ones.
There are.
Yeah.
They've improved the old granny look into some pretty stylish looks. So
yeah, it's true. And I think, is it true that insurance sometimes will cover it? Because a lot of people are here ending the end of the year thinking like I need to also.
Yeah, the majority of the work that we do is all covered by insurance.
That's
I won't
great.
lie in my records and accentuate things that aren't there. However, when we do our screening and I take my detailed history of their symptoms, and they realize, oh my gosh, this actually is affecting my life. I'm standing when because I need to get up, or oh my gosh, my legs are tired, I need to sit down. Then that is the definition of medical necessity, and so we'll take the time and figure that out.
Grand opening of the Brookfield location happening this week, Wednesday, October 9th from 11 to 1 p.m. They're located on West Blue Mound Road. The address is there on your screen for Mequon Vane, now located in Brookfield. The phone number is 262-240-9640, mequonvane.com, Germantown, Mequon, and now Brookfield. Congratulations.
Yeah, congrats.
Well, thank you both so much.
Thank
My
you.
pleasure to be here.
Appreciate
Thank you.
it.